Hi, I am Dr. Ramesh, practicing dental surgeon at Bannerghatta Road from past 15 years. Bad breath commonly, in a medical term, it is called as halitosis, caused by poor dental hygiene or dental health, gingivitis or periodontitis or bleeding gums. These are the oral defects, what we call, or sometimes it may be infectious medication for liver or kidney or lung abscess, etc. And sometimes GIT infections. These are all systemic factors which leads to bad breath. And the treatment goes like this: improving dental hygiene, that is oral hygiene, or periodic scaling, root planing or curettage, commonly known as oral prophylaxis, or treating the gum, that is through flap surgery or sometimes, or any other defect should be treated. If not cured by this, we should take systemic factors into consideration. Mobile teeth, the common causes are tooth abscess and gum disease. Severe tooth decay or gum disease, that is gingivitis or periodontitis, causes inflammation of the tissues around the teeth, thus causing an abscess. Thus the teeth will become mobile and hence has to be removed. When plaque and other deposits begin to develop beneath the gum line, an infection can occur which left untreated, the infection can destroy the gum tissue and damage the periodontal ligaments holding the teeth. Earlier stages with bleeding gums, it is called as gingivitis. In later stages, when mobility is there, it is called periodontitis. The treatment goes like this: the abscess teeth, removal of the teeth, or sometimes we can do a root canal and save the teeth. The gum disease, wherein we do a scaling, root planing and curettage, or a flap surgery or bone grafting, or sometimes for the mobile teeth, splinting. Dental decay or dental caries. It's a common disorder, occurs in child and also in adults, can affect any person. Tooth decay is a common cause of tooth loss in younger people. Tooth decay is caused by bacteria found in mouth. These bacteria convert the sugar and starch present in the left out food into acids and thus decay the teeth. First layer involves enamel, second layer involves dentine, pulp. Then therefore when it is involved the pulp, in later stages there will be abscess. The treatment goes like this: proper oral hygiene, brushing, flossing and using a mouthwash. This is a common thing. The next treatment mode will be restoration, that is cementing of the carious lesion. In advanced stages we do root canal treatment, and sometimes where there is a abscess teeth, there is no treatment, we have to extract the teeth. Sensitive teeth or sensitivity, commonly it's a common problem now. It may be because of the worn out teeth, gum exposure, recession, or exposure of the dentinal tubules, or sometimes with the gum exposure. Worn out teeth may be cracked teeth, chipped enamel or flattened tooth. The treatment will be root canal, or if it is abscess teeth with all the infection, it has to be extracted.